What if depression isn't just one condition, but many different disorders that can affect the brain in completely different ways? Most people think depression simply means feeling sad, but the reality is far more complex. Some types appear only during certain seasons, others follow major life events, and one can resist even the best available treatments. The most surprising part? Many people live with these conditions without realizing there's a specific explanation for what they're experiencing. So let's count down the major types of depression and discover what is really happening inside the brain. Number 10. Major depressive disorder. Depression is far more than simply feeling sad after a difficult day. Major depressive disorder is one of the most common and serious mood disorders, affecting the way a person thinks, feels, and functions. Researchers have found that changes involving brain networks, neurotransmitters such as serotonin and dopamine, stress hormones, genetics, and life experiences can all contribute to its development. People often lose interest in activities they once enjoyed, struggle with motivation, experience persistent feelings of hopelessness, and find everyday tasks unusually difficult. Concentration declines, decision-making slows, and sleep may become either excessive or severely disrupted. Appetite and energy levels frequently change as well. Unlike temporary sadness, these symptoms persist for weeks or longer and significantly interfere with work, relationships, education, and overall quality of life. Early recognition and appropriate treatment, including therapy, lifestyle changes, medication when appropriate, or a combination of approaches, greatly improve the chances of meaningful recovery and long-term emotional stability. Seeking professional help early often prevents symptoms from becoming more severe and improves long-term recovery outcomes for many individuals. Number 9. Persistent depressive disorder. Not all depression arrives with overwhelming intensity. Persistent depressive disorder, sometimes called dysthymia, develops as a long-lasting low mood that continues for 2 years or more in adults. Researchers describe it as a chronic form of depression where symptoms may be milder than major depression, but remain remarkably consistent over time. Many people continue working, studying, and fulfilling responsibilities while quietly struggling with low motivation, reduced self-esteem, poor concentration, and limited enjoyment in daily life. Because these feelings become part of everyday routine, individuals often assume this is simply their personality rather than a treatable medical condition. The brain gradually adapts to functioning under constant emotional heaviness, making happiness feel unfamiliar rather than impossible. Although symptoms may fluctuate, the prolonged nature of the disorder can significantly affect relationships, productivity, confidence, and long-term emotional well-being if left untreated. Early diagnosis allows individuals to receive support before years of persistent symptoms continue affecting both mental and physical health. Number 8. Seasonal affective disorder. As the seasons change, some people's mood changes with them. Seasonal affective disorder is a type of depression that typically appears during the darker months of the year, when daylight becomes limited. Researchers believe reduced sunlight may influence the brain's production of melatonin, serotonin, and the body's internal circadian rhythm, all of which help regulate mood and sleep. People commonly experience low energy, increased sleep, difficulty concentrating, reduced motivation, and stronger cravings for carbohydrate-rich foods. Everyday activities that once felt enjoyable may suddenly require tremendous effort. Symptoms often improve naturally as daylight hours increase during spring and summer. Although the condition follows a seasonal pattern, its emotional effects are very real and can substantially interfere with work, school, relationships, and overall quality of life without appropriate treatment or professional support. Light therapy, regular exercise, and maintaining daily routines may also help reduce symptoms for many affected individuals each winter. Number 7. Bipolar depression. One of the most misunderstood forms of depression occurs as part of bipolar disorder. Unlike major depression alone, bipolar disorder includes episodes of depression, as well as periods of unusually elevated or irritable mood, known as mania or hypomania. Researchers studying mood disorders have found that changes in brain circuits involved in emotional regulation contribute to these dramatic shifts. During depressive episodes, individuals may experience hopelessness, fatigue, slowed thinking, and loss of interest in activities. Because manic episodes may not always be recognized immediately, bipolar depression is sometimes mistaken for major depressive disorder. This distinction matters because treatment approaches differ significantly. Proper diagnosis allows healthcare professionals to choose therapies that address both extremes of mood, helping reduce future episodes and improve long-term emotional stability. Recognizing patterns of mood changes over months or years often plays a crucial role in reaching an accurate diagnosis. Number 6. Postpartum depression. Bringing a child into the world is often expected to be a joyful experience, yet some new parents develop significant depression after childbirth. Researchers believe postpartum depression results from a complex interaction between rapid hormonal changes, sleep deprivation, genetic vulnerability, physical recovery, emotional stress, and environmental factors. Unlike the brief emotional changes commonly known as the baby blues, postpartum depression lasts longer and interferes with daily functioning. Symptoms may include overwhelming sadness, anxiety, guilt, loss of interest, difficulty bonding with the baby, changes in appetite, and persistent exhaustion beyond normal newborn care. Early diagnosis is especially important because effective treatment supports both the parent's recovery and the healthy development of the child. With appropriate care, most individuals experience substantial improvement and regain emotional well-being over time. Strong family support, counseling, and medical care together greatly improve recovery while strengthening both parent and infant relationships. Number 5. Psychotic depression. In some cases, severe depression is accompanied by a loss of contact with reality. This condition is known as psychotic depression. Researchers have found that alongside the typical symptoms of major depression, individuals may experience hallucinations, delusions, or deeply distorted beliefs that often match their depressed mood. A person may become convinced they are beyond help, responsible for disasters they never caused, or deserving of punishment despite having no evidence for these beliefs. These experiences are not simply negative thoughts, they reflect changes in how the brain processes reality itself. Because psychotic depression carries a higher risk of self-harm and severe functional impairment, immediate professional treatment is essential. With appropriate care, including medication, psychotherapy, and sometimes hospital-based support, many people recover and regain a stable connection with reality while significantly reducing depressive symptoms. Early intervention often improves recovery, reduces complications, and helps individuals safely rebuild confidence, relationships, independence, and long-term emotional stability. Number 4. Atypical depression. Despite its name, atypical depression is not actually rare. Researchers use the term because its symptoms differ from the more classic pattern of depression. One defining feature is mood reactivity, meaning a person's mood can temporarily improve after positive events before later declining again. Individuals often experience increased sleep, greater appetite, weight gain, heavy feelings in the arms or legs, and heightened sensitivity to criticism or rejection. These symptoms can make work, relationships, and social situations especially difficult because emotional reactions become unusually intense. Although moments of happiness still occur, they rarely last long enough to overcome the persistent underlying depression. Proper diagnosis helps distinguish atypical depression from other mood disorders, allowing healthcare professionals to choose treatments better suited to this specific symptom pattern and improve long-term emotional functioning. Lifestyle changes, therapy, and carefully selected treatments often help individuals regain emotional balance and improve their overall daily quality of life. Number 3. Premenstrual dysphoric disorder. For some individuals, hormonal changes before menstruation trigger emotional symptoms that extend far beyond typical premenstrual discomfort. Premenstrual dysphoric disorder, or PMDD, is a severe mood disorder linked to the menstrual cycle. Researchers believe certain individuals have an increased sensitivity to normal hormonal fluctuations, leading to significant changes in brain chemistry affecting mood regulation. Symptoms may include intense sadness, irritability, anxiety, difficulty concentrating, sleep disturbances, and feelings of hopelessness during the days before menstruation. These symptoms usually improve shortly after the menstrual period begins, only to return during the next cycle. Because PMDD follows a predictable monthly pattern, careful tracking of symptoms often plays an important role in diagnosis. Appropriate treatment can greatly improve emotional stability, relationships, work performance, and overall quality of life. Understanding hormonal patterns empowers individuals to recognize symptoms earlier and seek effective medical support before emotional distress becomes overwhelming each month. Number 2. Situational depression. Not every depressive episode begins without a clear cause. Situational depression, also known as adjustment disorder with depressed mood, develops after major life events such as losing a loved one, divorce, financial hardship, serious illness, or other significant changes. Researchers explain that while sadness following difficult experiences is completely normal, some individuals develop symptoms severe enough to interfere with daily functioning. People may lose motivation, struggle with sleep, withdraw socially, or find it difficult to adapt to their new circumstances. Unlike some other forms of depression, symptoms are closely connected to the triggering event. Even so, the emotional pain is genuine and deserves attention. Therapy, strong social support, healthy coping strategies, and time often help individuals gradually recover as they adjust to life's challenges and regain emotional balance. Building healthy routines and maintaining supportive relationships can significantly strengthen emotional resilience throughout the recovery process and beyond. Number 1. Treatment-resistant depression. Perhaps the most challenging form of depression is treatment-resistant depression. Researchers use this term when depressive symptoms continue despite trying multiple evidence-based treatments under appropriate medical supervision. This does not mean recovery is impossible. Instead, it highlights the complexity of how depression affects different brains. Scientists continue investigating genetic differences, brain circuitry, neurotransmitter systems, and other biological factors that may influence why certain treatments work well for some people, but not others. Individuals with treatment-resistant depression may require specialized care involving medication adjustments, psychotherapy, newer treatment approaches, lifestyle interventions, or carefully supervised brain stimulation therapies. Although the journey may take longer, ongoing research continues to expand treatment options. With persistence, comprehensive medical care, and individualized treatment plans, many people eventually experience meaningful improvement and regain hope for the future. Continued collaboration between patients, families, and healthcare professionals often leads to better outcomes and renewed confidence during the recovery journey. Thanks for watching. Like and subscribe to see more.